Now, tell me about your symptoms before our surgery.
I had leg pain, um, back pain for way over a year. I'd had spinal injections. They did not work. Um, I was referred to Dr. Abbasi from my chiropractor, Dr. Chris Singer in Detroit Lakes, Minnesota.
Yeah. Now, your pain, 1 to 10, how bad was it?
Pretty bad. I was in the hospital with way above 10 for pain.
Yeah. And I'm going to ask as well your family about what did you observe about how was her life before the surgery?
Before surgery, she was very minimal on moving. Sure, Jeff and I would check on her. Jeff would see her daily. I'd be there every other day. But she could not clean house. She could not cook for herself.
She was dependent on others a lot
Yes.
for daily activity. And you know, we looked inside of you and we noticed you have significant problem in the spine. None of that was in your head. Your spine was literally in a bad shape, and the bone was grinding the bone. That can give lots of pain, and what you describe is very typical for this. Now, this has been going on for a while, and I'm sure you tried all the non-surgical treatment and they weren't helping you. You were offered surgery by another surgeon. Without telling the names, tell me your experience. What did they offer you? What did they tell you about what you need?
The other surgeon, yes, he said I needed the fusions, but he would have opened my spine, peeled everything back. I would have been in the hospital 3 days. The surgery time length could have been 3 to 8 hours. I would have been in the hospital for at least 3 days, probably nursing home care for at least 21 days or longer. The physical therapy. I'm very glad I came down here.
Yeah. But your surgery was about 6 months ago, about.
Her surgery also, the other doctor had said it would have been a 2-stage surgery.
Oh, 2-stage surgery, okay.
Because remember, you had the pinched nerve. He wanted to go through, I don't remember if it was the right or the left side, but to relieve that nerve. And
So
then,
2-day surgery even, or multiple stage surgery.
yeah, and then turn her over and do the back.
Yeah,
Yes.
so 2-stage surgery, each of them a few hours and so on, and then each of them 3 days in the hospital. Then you would qualify to go to nursing home and about 3 weeks stay in the nursing home. Now, we did that surgery, I think about 5 months ago actually, about right? In July, and toward the end of July.
Yeah.
So this is December, so 5 months ago. How are you now?
I'm 99% better. I'm walking better. I'm able to do my own housework.
So you're independent. And that was the goal of the surgery, to make you independent. So what is your observation regarding how her life is now?
Compared to what it had been, she's fantastic. She's able to, yes, she drives, but she doesn't drive any great distance without somebody with her. Like she said, she can take care of herself. She does her housework. She does her laundry.
So you don't have to stop your life to help her.
Correct.
And that is as well, that's a major goal of the surgery like that. Unfortunately, we are not going to make you younger.
Right.
And I'm going to turn around and show what we did. This wasn't a small surgery. This was at L3 to S1 fusion. You have problems other level. And one of the things we promise our patient, we do smallest surgery that can give you maximum benefit. And even though you have some problem there, we identified the problem, most of the problem to be here. Scoliosis is corrected, and everything is actually growing just 5 months later. And here is the record of the surgery. Our surgery was 72 minutes, and our blood loss less than 100 cc. And you stayed only over the night in the hospital. Is that about right?
Correct. That sounds
So
correct.
did you go home after that, or did you go to nursing home after
No, I went home.
You went home. So this is, you see the difference between the open old-fashioned surgery and what we do. This just summarize it, just 1 night in the hospital going home instead of 21 days in a healthcare facility. and being able to make you independent. And another thing that I think is important is that we don't have to fix everything to be able to help you. This is what we do. We identify what's causing your problem and then do the minimum surgery, and we fix future problems in the future. And this, what we call segmental scoliosis correction, has been extremely beneficial to our patient. People who have been told, just live with it because surgery will kill you, now we can help. Okay, and I think that is the important thing that I like to convey to my colleagues, that you don't have to let the patient live in horrible pain because you think the bar is too high.
Right.
Okay. Now, we have to see you again in about 6 months. Hopefully by then, as well, bone in the back is growing, but bone is growing in the front, which is already fantastic, because in your age group, in the open old-fashioned surgery, we never see the bone growing just 5 months after surgery this well, which we do see it in your case. Now, what question or comment do you guys have for me that you like to convey to other people, or because if you have that question, probably other people have the same question.
Anybody that's got this type of pain in their back or their legs, explore your options before you have surgery.
Yeah.
Yes.
This type of surgery, from what I've heard and what I've seen, I've had friends that have had the other types of surgery, well, they're going back to have the screws fixed or the wires tightened or redoing everything. From what I've seen here, this is a one-time surgery. You don't have to go back. So explore your options and look forward to somebody else all the time.
Yeah, and I think nobody could have said it better. There are options today, and most of the time people don't know they have other options, and they think that's the only option they got. And I think this is what this video is about, to make people understand that there are good options out there.
Yes,
Okay.
there are.
Yeah.
Well, thank you so much. I really appreciate this interview.
No.
Thank you very much.